Hello everyone, today I am going to tell you the details of measles rubella vaccine or measles, mumps and rubella vaccine MMR. Measles rubella vaccine which is available in the government supply. It is a freeze-dried vaccine. It's containing the live attenuated measles virus administered Zagreb strain and also containing the RA273 rubella virus. While in the MMR vaccine, measles, mumps, rubella, with these two measles and rubella virus also containing the different mumps virus strain according to different formulation. There are various MMR vaccine available in the market. At the end, I am going to tell you the details of MMR vaccine which is available in private. While in the government supply in National Immunization Program, we are giving the MR vaccine which is containing the live attenuated measles and rubella virus. Now, what is the diluent? Because it is a freeze-dried vaccine. So, diluent is distilled water. So, you can easily remember that MD, M for measles, D for distilled water. Because sometimes students also confused and sometimes by mistake, instead of using the diluent distilled water, if we use a normal saline, then various complications can occur. Similarly, with the BCG, diluent is normal saline. And instead of using the normal saline in BCG, if we use the distilled water, then again various complications can occur. So you can easily remember by the trick, measles diluent is distilled water MD and BCG diluent is normal saline. So now after reconstituting with the distilled water, MR vaccine should be used within 4 to 6 hours. Otherwise, there are chances of contamination with the staphylococci which will release the exotoxin and it will lead to the toxic shock syndrome. Even if the cape of the MR vaccine is punctured, then also this vaccine should not be used because chances of TSS are very high. Now, what is the dose, route and schedule of this vaccine? Dose of MR vaccine is 0.5 ml. Route is subcutaneous. We have to give in right upper arm. And what is the schedule? We have to give the 2 doses in National Immunization Program and 3 doses according to Indian Academy of Paediatrics. So in National Immunization Program, first dose we have to give at 9 months completed and second dose we have to give between 16 to 24 months of life. So first dose should be given between 9 to 12 months of age and second dose should be given between 16 to 24 months of age according to the National Immunization Program. Minimum 2 doses should be given. According to the IAP, 3 doses should be given. First dose at the 9 completed month, second dose between 15 to 18 months of age and third dose between 4 to 5 years of age. And according to IAP, MMR vaccine should be preferred. Now, what are the side effects of MR vaccine? Sometimes patient may develop the rashes, sometimes develop the arthralgia, or sometimes ITP in 1:30,000 vaccine recipient. Immune thrombocytopenic purpura can be developed. So these are the side effects of rubella component. And similarly with the measles, sometimes patient may have the rashes and sometimes may be having the other mild side effects. But the severe side effect of measles is anaphylactic shock, which is very rare but can occur. Now, what are the contraindications when this vaccine should not be given? First, during pregnancy, this vaccine should not be given whenever we are giving this vaccine, at least gap of 4 weeks should be there before conceiving. So we can give the 4 weeks before conceiving, but not during the pregnancy. But sometime ask in the Viva, if accidentally given during the pregnancy, is it the indication of MTP? So answer is no, no indication, but we should not give. But accidentally, if it is given during pregnancy, then this is not the indication of MTP. Now, second contraindication of MMR or MR vaccine is immunodeficiency, either acquired or congenital immunodeficiency if having or had received the high dose of steroid for more than 14 days. Then also patient is having the immunodeficiency, so should be avoided or should be postponed. And another contraindication of this vaccine is if patient is having severe allergic reaction, then this vaccine should not be given to the any component of MR. As I said, severe anaphylactic reaction can occur. So if with the previous first dose patient already had the anaphylactic reaction, then the second dose should not be repeated. What are the conditions in which we should take the precautions? So if the patient is having any moderate or severe acute illness, or if patient had received the antibody containing blood product in last 3 to 11 months, or if there is a history of ITP or thrombocytopenia, then this vaccine should be given with the precautions or should be avoided.